start this morning in kind of the way of Margaret Mead, of an anthropological journey as a participant observer through a 40-year healthcare career. I'd like to share a quote with you from Rachel Naomi Remen. Everybody has a story. When I was a child, people sat around kitchen tables and told their stories. We can't do that so much anymore. Sitting around the table telling stories is not just a way of passing time. It is the way the wisdom gets passed along. The staff that helps us to live a life worth remembering. Despite the awesome processes of technology, many of us still do not live very well. We may need to listen to each other's stories once again. There are words that have crept into our literature, exploded into our literature over the past probably 10 to 15 years. It was not a healthcare environment that I started out in, but it has become the healthcare environment that is our reality today. We hear words, and there they go, all right. I'm having the same trouble everybody else has with just pushing a little button here with this technology. We hear the words that were not part of my early career in healthcare. I believed when I started on my journey that it was a calling, that I was called into a healing profession, to be part of a healing environment, to care for others. As I have grown and walked along this journey, I have come to the understanding that we have opportunities in our environment to change the way we live. Some of those words that have bludgeoned into our literature are moral distress, taking care of patients over and over again in healing environments leads to the accumulation of moral distress, of compassion fatigue. As we as healthcare providers face ethical dilemmas, spend time with people in the most vulnerable moments of their lives, when they're not at their best, and sometimes when we're not at our best, we face the accumulation of these life events that we share with others. Personal tragedies in our own lives that shape how we interact with others. So over time, we have created that stuffing, that amygdala hijacking that we learned about this morning, that continues to frame what we do because we haven't addressed our own ways of being in the healing world appropriately. As nurses, we've been accused of eating our young. And I would argue that we still do that under the best of circumstances. We don't value the gifts that all of the generations bring to our workforce. As baby boomers, we expect Gen Xers and Gen Y to live the same way we do, to provide the same care that we provided, to have the same work ethic and value systems that we hold dear, sometimes not being open to learn from them what they bring to our world that is best and brightest and adds to that great complement of healing healthcare environments that we share. We also now talk about workplace violence. There is a bill before the session in the Texas legislature this year driven by the Emergency Nurses Association about workplace violence, about assault. There are people who are fearful to come to work because of the interactions that they may have with not only patients and families, but sometimes with colleagues and peers. I charge us today as leaders that we must move beyond this kind of dysfunction, this kind of distress. I've had the good fortune to work with great leaders who are transformational, such as Dr. Britt Barrett, Dr. Cole Edmondson, and others, that I've worked in organizations with and walked this journey with to try to change the way we lead and change the way we heal, How many of you have flown recently and listened to a flight attendant say, if you are traveling with a child and the oxygen mask comes down, put it on your child, put it on yourself first and then on your child. We are so cultured to think of others before we think of ourselves. I charge you today that we must change that culture. So I'm going to try to move us into some words of mind, body, spirit healing as healthcare givers, as healthcare leaders. We must create healing environments because if we do not, we cannot achieve the patient outcomes. We cannot shape patient experiences. We cannot improve health in our country. I don't know how many of you have looked at Texas health outcome statistics, but we have challenges around that in this state and certainly nationally. We have many healthcare conditions that have risk factors that are preventable. We started talking about primary care and health prevention when I was very first starting out in healthcare and in nursing. I'm not so sure we've done a great deal about that. We still live in illness models. So I would charge each of you to go back, to remember what brought you to healthcare. Remember what keeps you in healthcare. There is a great educator that has really impacted some of the work that I've done and the development that I've done as a leader. And his name is Parker Palmer. And he is an educator by background, but he is also a wonderful spiritual guide. And in several of the books he has written, he charges us to be authentic. People figure it out. If you've ever worked with children, if you're not authentic, they got your number right away. They know when you're not being authentic as a leader, as a person. And so will your colleagues, so will your peers, so will the patients you take care of. If you're not connected to what you do, to how you lead, all of those in your environment will know that. So I challenge each of you today to reconnect your soul with your role, to get in touch with that passion that brought you to what you do. It will go a long way to help you heal personally, professionally, and to emit that healing environment and presence to others around you. If we don't do that, we do disservice to our colleagues and to those for whom we care. There's something else in the literature talked a great deal about that we've always associated in faith environments with faith beliefs and with spirituality and faith traditions. But there is a good bit coming out in the literature today about forgiveness and about moral courage. I would ask you to go and look up some of that literature as you leave here and really study the importance of how that plays a role in how we lead and how we care for others. We have to be willing to forgive each other. And that doesn't mean we forget, but it means that we don't carry that with us. We don't take that amygdala hijacking into our interactions with all of those around us because we are stuck in carrying a grudge and not being able to forgive those with whom we work on a daily basis. If we don't form transformative teams, if we don't change the way we lead and the way we care for others, we are going to have a sick, dysfunctional healthcare environment that truly I challenge each of us to change. Sometimes it's hard to tell those stories or share those experiences when our major mode of communication is through text or email. My apologies to my younger generational partners here. But we have got to have conversations. How many of you, when you get an email that hijacks your amygdala, get up and walk away from it? Don't respond. Don't get into those circular arguments with people. Don't have a meeting via email. Pick up the phone. Have a conversation with people. We have much work to do to heal ourselves. It's very easy to preach these philosophies without living them. I recently got a group of individuals in the organization where I work now together to talk about how we might manage stress in our environment. And I'm partnering with our colleagues from our employee advisory program and also from pastoral care to really change what we are doing in our healthcare environment to support the caregivers who care for patients every day. We no longer can say, stuff that. This is not important. Take the next patient. We have to listen to folks, and we have to change the way we create healing within our environments. And as leaders, we have to model that. We can't just talk about it. We have to do it. I've watched Dr. Barrett many times go out and deliver cookies on units and talk to staff and get dunked in dunking pools to really create humor and a sense of fun. But all of that work was intentional in developing relationships, bringing your humanness, your personhood to all the work that you do. So I charge you today, each one of you, to go out this weekend and do something for yourself. Do something to heal yourself, body, mind, and spirit, and think intentionally of using all your senses to make that work. And I would like really to close with a quote. And by the way, this is a really great little book, Reclaiming Soul in Healthcare. Who knew there was a soul in healthcare? But here we are. At the systems level, the soul of healthcare will be restored to the degree that each individual takes responsibility to embody soul personally. We cannot afford to go forward building bigger and more dehumanizing systems as if soul did not matter. With compassion at the center of each person's spirit, we have hope of creating life-giving health systems. Healers, heal yourselves.